Hello everybody, I am ildikonyari and this is an update on the coronavirus COVID-19 information that I provided on April 12. You probably know this slide from the April 12 information. This is just to remember that if there is a virus outbreak and if that cannot be controlled, then it may become an epidemic. And if that cannot be controlled, then it becomes a pandemic, like the coronavirus COVID-19 outbreak became a pandemic across continents, and it looks like a social collapse. And if that cannot be controlled, like we are struggling here in America and in worldwide to control it, then it may become seasonal, and it's called endemic. So the question is that is there a treatment or some kind of magic pill for this new virus? There is a lot of research. And on the April 12 presentation, I provided some research activities and some treatments that they are considering to against the virus. Here I just want to focus on three critical solutions that is needed. One, to treat the illness better than we actually can, and to contain the virus against spreading, and to have immunity against it. So again, on April 12, I provided several solutions to treat the virus. Here I just want to focus on Remdevisir by Gilead. They have a clinical trial already at the University of Chicago. 125 patients enrolled in this trial, and it shows positive results. This is an anecdotal evidence that the drug works. They showed rapid recovery after a few days or a week. They use the injection version of the drug and not the pill version. And the other one is a vaccine by Moderna in Massachusetts. They are already in the phase 1 clinical trial on healthy patients. And parallel, they are also manufacturing the drug, for which the government provided $483 million awards to the manufacturing process. And then it will move to phase 2 in the clinical trial to test the vaccine on a wider range of population, especially on the upper age groups, on elderly people, and also people with comorbidity risk factors. And then in the summer, they will see how the antibodies are working after injecting this vaccine in people, and how this antibody can neutralize the virus. And in the fall, they will start the surge manufacturing, and probably in next year, 2021, it will be available for commercial use. And the other one is a blood treatment, convalescent plasma antibody treatment. The leading research institution is the MAYO Clinic. People who recovered from the virus have antibodies in their blood, and if it is in high concentration, then they can create a serum out of it and use it in patients. For example, in pregnant women and other people, and they have very good positive results, but these are still just anecdotal positive results. They want to use scientific rigor to know why and how it works and when to use it. So far they are using on very sick people, and it might be good to use it at early stage to prevent hospitalization, or if they are in hospital, then to use it at early stage so they can be discharged much earlier in the ICU unit. They are looking for blood donors who have antibodies in their blood and in high concentration. And already a lot of patients signed up for this convalescent plasma treatment. And this is basically associated with serological testing, because if there is a positive result that there is antibody in the blood, the person was infected, then they can check if it is if the concentration of the antibody in the blood is high enough to be able to use the person's blood as a donor. The other one is Sanofi with Glaxo. they partnered with Glaxo, and there are 3 research activities: vaccine, treatment, and testing. Their vaccine will be mass produced and will be available in 2021. The treatment is basically a scientific study of the chloroquine drug, why and how it works. And they already discovered that the virus somehow causes a blood clog in the lung, and perhaps it is the reason why chloroquine works, in addition to having an immune supportive support. The clinical study didn't finish yet. However, they already started surge manufacturing the chloroquine drug because they are donating the chloroquine to hospitals and health centers. The other one is a new testing method, the saliva testing. The saliva is not new per se. It is basically spitting in a tube, and then the PCR test if there is the virus or not. However, Sanofi has partnered with the Luminotics tech firm because they are creating a type of saliva test that can be used in a smartphone app, and in 30 minutes it will provide the result. And hopefully this testing method will have a high accuracy. So during this 1 month economic shutdown and the COVID-19 pandemic, certain issues surfaced. First of all, we have to contain the virus to prevent from spreading, but we need to know its mortality rate. So the mortality rate is the died people relative to the infected people, but we don't know how many people were infected. So this denominator is unknown. And we have to know the true figure, the true mortality rate of this virus. To know the infected people, we have to do serological testing to know how many people developed antibodies in their blood. What we know as of April 19, that in the US, 762,000 confirmed cases that were tested and positive infected people, from which more than 40,000 people died. So the mortality rate is 5.3%. Globally, it was 6.9%. And if we compare this to, for example, the MERS virus, that had a mortality rate of 34.4%, significantly higher. And the SARS virus, which had a mortality rate 9.6%. But these viruses, the MERS and the SARS virus, did not spread that easily in comparison to the COVID-19. So these figures, so we have to keep this in mind. And to know the real mortality rate, we need to know the denominator, how many people were truly infected. And to know this data, we need to run studies. In California, in Santa Monica, they are running a study, a serological study by Stanford University. And the early indications suggest that the number of infected people are 10 or 50 times higher than what we have tested so far, because test kits were not available. And if we calculate this, that it is 10 times higher, if not 50 times higher, if we use the worst case scenario that it is 10 times higher, then the mortality rate is 0.53%, which is significantly lower than the 5.3%. And if it is 0.53%, then it is higher than the seasonal flu with a 0.1% mortality rate, 5 times higher, but significantly lower than, for example, the MERS and the SARS virus. So then why is COVID-19 virus so dangerous? Because it spreads more easily, and it also spreads when there are no symptoms. So we don't know when a person is infected and that person infects another person. And it is why we have to keep social distancing and to be 6 feet apart from each other. And it also can survive on surfaces, and a contaminated surface can infect a person as well. And also the recovery time in ICU unit takes much longer in the COVID-19 case than in, for example, a seasonal flu case. If we compare it to the swine flu, which spread more easily, but it was not as deadly than the COVID-19 virus. So this leads to the economic shutdown, because so many things are unknown about this new virus, COVID-19, the true mortality rate, and also how it spreads exactly. It is why we have been asked to stop all our business activities and individual activities to save lives, to protect lives. And this economic shutdown that already lasts for 1 month cannot last forever. We cannot compare lives to dollars, we only can compare lives to lives. And if it lasts longer and longer, then we will be more and more in the depression, and it will create more financial problems to families and individuals and also businesses. And the business problems will lead to employees and family financial troubles. And it also can cross countries, so there could be a global economic downturn and collapse. So we really have to think about how long can we go on with this economic shutdown. Poorer countries will suffer the most, and the low-income people will suffer the most. So far, the GDP rose across countries, and this created life expectancy increase across the countries. However, if there is an economic depression and even a global economic collapse, then this life expectancy rate will turn downward again. And we will see an even more widening gap in wealth distribution than we already had so far. So this is the reason why we need to think about how long can we go on with this economic shutdown, with this universal economic shutdown. Maybe we should have a different solution, a more targeted quarantine, a more targeted isolation system than it is right now. And this economic shutdown created financial issues to families, individuals, employees of businesses who closed down or didn't get loan, small business loan, and the families who did not receive the stimulus payment or did not qualify, or the paper check will come only later. So these families have financial trouble to pay their checks, to put food on the table. And for example, on the video is California, where the food bank is distributing foods to people, to families, individuals. And the farmers are struggling to find a way to channel their produce to the end users, to families, retailers, or the food bank. And the US Department of Culture has a challenge to how to coordinate this supply. And some farmers produce to restaurants, but these restaurants are closed, and they couldn't find a channel how to distribute their produce to end users, to families, retailers, or to the food bank. And they dump their crops or their produce. The orders are as good as the public cooperates. And that depends on the trust in the government, how much people trust in the government. And if there is no trust, then people will not cooperate. So families do not comply or stop complying, or they question to comply with the stay-at-home orders. So people want to go back to work, they need their income, and they want to move on their life, they want to go to school. For example, in California, New York, Ohio, Maryland, Virginia, Michigan, and they question their freedom of movement, and they question their free speech and the Bill of Rights. So in essence, their constitutional rights are in question, and the government didn't compensate them for the loss of income or additional expenses for calling it national security. And also some legal experts say that President Trump may not have the authority to impose such a nationwide lockdown, and especially for such a long time, or even longer time. So what do these protesters say? What is their message? They say, thank you, government officials, for your recommendations, but we are going back to work. Open our school. Education is a God-given right. It's a park. Viruses don't flow through the air. You are not going to catch it walking in a park, so there is a lot of misinformation. So Big Pharma can take over, give us all vaccinations, and make us all stupid and sit home on our couch and comply. There is an underlying agenda that most people don't see. I take care of my body and exercise. Let us work. Let us work. And what the governor's answer to the demonstrators is, for example, to have an American president to encourage people to violate the law. I can't remember any time during my time in America where we have seen such a thing. President Trump's comments were dangerous because they can inspire people to ignore things that actually can save their lives. And it is doubly frustrating to us governors because there is such a schizophrenia, because the president basically is asking people, please ignore Dr. Fauci and Dr. Birx. And courts who question restrictions is, for example, a Kansas court where two churches filed a lawsuit where the governor of the state specifically targeted religious groups to prevent them for religious gatherings, indoor gatherings of 10 people or more. And the federal judge blocked it because he felt that these restrictions specifically targeting religious groups to gather indoor. However, the judge upheld the governor's restrictions to keep the social distancing and to be 6 feet apart from each other and not to use a collection plate. So basically the judge felt that the restriction clearly targeted religious gatherings, the religious freedom, and the right to free speech. In contrast to the Kansas court case, for example, there's been a New York gathering where a funeral was held for a 95-year-old rabbi on April 5th, when New York City was clearly in a stay-at-home order and under a restriction of indoor gathering of more than 10 people. And thousands of people gathered outside. They stood shoulder to shoulder, so they have clearly violated the social distancing to be 6 feet apart from each other. And the police moved in to enforce the social distancing. They didn't have much success, and during this incident, 2 police officers were injured, for example. So one group of people are protesting to end the economic shutdown and to move back to work, to go back to work and move on with their lives. And another group is the healthcare workers who protest to have PPE, personal protective equipment, and in sufficient numbers to mass produce them and even to use the Defense Production Act. And also some healthcare workers and nurses are counter-protesting the other group who wants to go back to work, because the healthcare workers in the hospitals feel that the country is not ready yet to open up. So during this economic shutdown, in addition to the financial problems of families and individuals, Businesses also have financial troubles, especially through the small businesses, the mom and pop shops, the individual small businesses, because the small business fund dried up after certain days. And if we look at it, who used it, there is no disclosure, no central database. But Texas got more loans than any other states, even though they had less cases. Or for example, Harvard University received $9 million loan from this fund, and even though they have $41 million in endowment. Or the construction industry received the most money, or a steakhouse received $12 million, and they have more than 500 employees. So these companies clearly do not qualify, and there is no way to track who received money from this SBA fund. So that's why University of Chicago Booth School of Business is trying to track the companies who received a loan from this SBA fund. And because of this dry up and the small businesses did not get the loan they should have received, the Treasury is adding additional $310 billion to this fund. So watch out for April 23rd when they are likely to approve it. So again, this SBA fund was dried up by public and large companies who clearly do not qualify. These companies should have used the Main Street loan program that was created by the Fed to support the economy. That was the fund that was designed to these companies, and it was approved, but it didn't start yet because it is still in paperwork. Most likely it will start on May 1st. So this SBA program was clearly designed to small independent companies, retail companies, restaurants, mom and pop shops. So these are private companies who cannot tap into the public financial market for finance. It is the reason why the Fed created this SBA fund through the bank, and it is why the Fed is adding additional $310 billion to this SBA fund. So please watch out to April 23rd. So COVID-19 patients may consider to tap into their pension funds if they have financial pain. The Fed already changed or modified the pension plan, because if people withdraw money from the pension plan, then there is a significant penalty on that. So there are two options that people may consider. If you are under age of 59 and a half, then you can penalty-free withdraw money up to $100,000 or 100% on the balance of the IRA. And for 3 years, need to pay tax on the distribution or replace the money and you owe no taxes on it. Or the second option is that you can borrow $100,000 from the 401k, and the previous loan limit was maximum $50,000. Then you can delay the repayment for 1 year. But you have to advocate these changes at your employer, because the employer will not do these changes automatically. You need to ask for these changes, and perhaps they may implement it. And then during this economic shutdown, the question is, when can we reopen? When can we go back to work and move on with our lives? So there is a program that was created, a plan how to reopen America. To meet the gating criteria, for example, to enter phase 1 is need to have a downward trajectory in the flu and flu-like symptoms for 14 days, and it has to be confirmed in testing. So the hospitals and the medical centers need to have testing programs available, including antibody testing. And also hospitals cannot be overwhelmed with patients, or it cannot be crisis management. And testing and contact tracing among elder people, low-income people, racial minorities, and Native Americans should be available. the guidelines for individuals that people still need to wash their hands frequently, avoid touching your face, disinfect all the frequently used surfaces and items, and to use face covering when in public. And if you feel sick, then you have to stay at home and to follow the state and local guidelines, because they know exactly in that area what is applicable. And employers still need to encourage the employees for social distancing, to have PPE available for the employees, and to check the temperatures of the employees, and to disinfect the high traffic areas at the workplaces, and to monitor people who may have symptoms and to be able to trace their contact. So if the gating criteria is met, then they can enter phase 1. And it means basically, briefly, that the flu and the flu-like illness is clearly in a downward trajectory, and it is evidenced in testing. So when entering phase 1, then individuals, vulnerable people still should stay at home. Comorbidity people also should stay at home and need to keep social distancing to be 6 feet apart from each other. Need to avoid socializing in groups of more than 10 people, and to minimize the non-essential travel. Employers also should avoid or minimize the non-essential travel, and to encourage employees to telework. And employees can return to work, but only in phases, so not everybody at once. And special employers, for example schools, remain closed, or visitors to senior living facilities and hospitals are prohibited at this time. Large venues, sporting events, dining facilities should follow the physical distancing. Gyms can reopen, but only if they can provide strict physical distancing. And elective surgeries can resume, but only on an outpatient basis. And then, in order to enter phase 2, need to meet the gating criteria once again, so another 14 days. The flu and flu-like symptoms need to have a downward trajectory, and it has to be evidenced in testing. For individuals, vulnerable people should still stay at home, and also comorbidity people need to keep social distancing still to be 6 feet apart from each other. Avoid social distancing of more than 50 people, so a little bit we can ease from 10 people. The non-essential travel can resume. For employers, employees are still encouraged to telework, but they can't come back to work. The common areas still need to be closed, or to have a physical distancing in place. The non-essential travel can resume, and need to consider the special accommodation of vulnerable people. So for special employers, for example, schools can reopen. Visitors to senior living facilities and hospitals are still prohibited. Large venues, sporting events, dining facilities can operate, but with physical distancing. And the elective surgeries can resume on both out and inbound basis. And to enter phase 3, need to meet the gating criteria once again. So for 14 days, the flu and flu-like symptoms need to have a downward trajectory, and also to evidence it in tests. For both individuals and employers, vulnerable people can resume to have public interaction, and the low-risk individuals still need to minimize their interaction, the time spent in the crowd, because we want to avoid the non-symptomatic spread. And workplaces can have a full staff, but they need to survey the non-symptomatic people. For special employers, visitors to senior living facilities and hospitals can remain open, and large venues, sporting events, dining facilities can operate with limited physical distancing. And gyms can stay open if they enforce good hygiene protocol. So during this pandemic, there's been a lot of question that why the testing kits are not available, and everybody looked at the CDC for an answer. It was discovered in January that the CDC had a contamination in their design and manufacturing line in the laboratory, and 40 kits were sent to state public health labs, and this test shown a false positive result. So because of that, the CDC outsourced the manufacturing of these testing kits, and then those were correct, but only in limited numbers these testing kits were available. And then 1 month in this economic shutdown and pandemic, what conclusion can we draw so far? So we need to have serological testing available and with high accuracy to know who has been infected, who has antibody in their blood, and in order to measure the correct mortality rate, and also to use this information for convalescent plasma treatment. We need to surge manufacture drugs and vaccines and to have that available quickly to hospitals and medical centers. And also we need to have self-testing tools available to be able to test a larger population and with high accuracy. And also this economic shutdown cannot last so long. It is unfeasible and unpayable because it hits the most vulnerable people, the low-income people and the poorer countries. Maybe we need to have a targeted isolation or targeted quarantining, and we also need to have a platform to coordinate food distribution from farmers to end users, families, food banks or retailers, which is now not available. So hopefully the US Department of Agriculture will develop this platform to prevent the dumping crops and produce because they are unable to channel it to the end user. And this economic shutdown created a financial burden on families, individuals, businesses, and the government did not fully compensate for the lost income and additional expenses, or did not compensate at all for some families, individuals and businesses. So it has to be considered. And also to reopen the economy, a phasing method, a phasing process was developed with staging and gating criteria to meet, which is dependent on the testing kits available. Which means that these testing kits really have to be available in sufficient numbers and widely and with high accuracy, otherwise it just doesn't work. And this economic shutdown and stay-at-home orders only work if the public cooperate. Once the public have question in trusting the government, then they may not cooperate anymore, and that will lead to demonstrations, and it may go as far as a civil unrest or a social collapse. So it is very important for the people to be able to trust in the government. Thank you for your interest, and stay healthy. Bye now.